Hello friends. Today here I am Prabhu Mishra, President of International Association of Stemcell and Regenerative Medicine IASRM. Here with Dr. Ana Maria Mihai, OB-GYN from Romania, Bucharest. In this program of fellowship in Cosmetic Gynaecology, 1-year program, she came here from Bucharest for their hands-on and practical training of Cosmetic Gynaecology, Regenerative Medicine and Functional Medicine. So we are going to share our journey of learning and experience through the words of Dr. Ana Maria and how this subspecialty is going to be implemented in her practice and for her patients. So Dr. Ana Maria, what's your opinion about these subspecialties and this program?
First of all, I want to thank you for all these great teaching lessons that we had in the last few days, and the whole program being organized so perfectly on regenerative medicine and also on cosmetic gynecology. You know, this is a really new field in Romania for us. Like, we are starting to raise the awareness and to skill our colleagues like you.
So you rightly said, Dr. Ana Maria, said this kind of courses program, the idea behind to bring this kind of courses to educate and create the awareness to the society and among the medical fraternity. Because these subspecialties always comes into the picture with many regulatory challenges and acceptance into the society. Right. Because these all are the new things like labiaplasty, vaginoplasty, monsoplasty, hudoplasty, and the many non-invasive or minimally invasive procedures like labia majora augmentation, volumizing with hyaluronic acid, and some pathological indications like vaginismus with botulinum toxins or the interstitial cystitis, premature ovarian insufficiency, thin endometrium, asherman syndrome, stress urinary incontinence. So the intimate revitalizations. So this kind of program, definitely it takes decades or a journey to accept and to implement and to the studies and bring into the practical aspects of the life.
The first step is to teach our colleagues how to do that, to be very well informed and skilled on that. And after that, every practitioner has to raise awareness on the patients, because they don't even know that there are options for their pathologies like vaginismus, like you said. There are a lot of women that suffer from that and have no idea that there are options of treatment on cosmetic gynecology. So
definitely. Here, so this kind of training program, that's why we brought
responds to a big problem.
So this kind of program, definitely I think it will help to the community, in our colleagues, in our researchers, in our scientists, healthcare practitioners, and definitely IASRM is going to bring many innovative things. And here we are also announcing you, like myself on behalf of IASRM and Dr. Ana Maria Mihai will bring very innovative program and holistic approach of intimate revitalization, rejuvenation program, anti-aging and regenerative medicine in Bucharest, Romania. And hope so it will help to a larger extent of the community and healthcare practitioners and colleagues to learn this kind of advances like PRP, stem cells, regenerative medicine, functional medicine and aesthetic medicine in their everyday practice. Thank you very much, Dr. Ana Maria Mihai, to being with us in this journey of learning and sharing and coming to India.
Thank you for having me and for this great scientific and cultural experience. I'm the most happy being here.
Thank you. Thank you so much.